these tobacco has almost 74 carcinogens. लंबे समय तक ये अल्सर्स रहने की वजह से they can transform into malignancy. Chemotherapy is mainly when the stage is in the later stages. In the earlier stages, surgery is definitely the treatment of choice.
लोगों को पता चलता है कि दे आर हैविंग कैंसर, और क्योंकि वो वैसे ही बहुत डरे हुए स्ट्रेस होते हैं, तो हाउ यू हैंडल देम?
We may also have to counsel not only the patient but their family as well, because this disease unfortunately is not only the patient's battle, but it is also the battle of all the family members and the support system. In colleges itself, younger students sometimes get exposed to these addictive habits. And hence, nowadays, we are seeing a lot of our patients in the second and the third decade of life, or they can be controlled because these are all lifestyle changes, lifestyle modification ke saath, these factors can be controlled.
Namaste, this is Gunjan and you're watching Health 360 with Apollo Pune. So let's talk about something that we often ignore, oral cancer. And this April month, we are observing it as an oral cavity cancer awareness. So let's understand it better with our special guest, Dr. Vidita Powle, Senior Consultant in Head and Neck Surgical Oncologist and Robotic Surgeon. Welcome, ma'am.
Hi.
Let's start with very basic. What is oral cancer?
So, oral cavity cancers are generally cancers that affect any part in the oral cavity. Now, oral cavity consists of parts of the inner aspect of the lower lip, the lower jawbone, the upper jawbone, and the mucosa over the jawbones, the inner lining of the cheek, the tongue, the floor of the mouth, the palate. All these areas are part of the oral cavity. And cancer essentially is rapidly undividing cells that are abnormal. And when the cancer process affects any of these areas in the oral cavity, it is known as oral cavity cancer.
Is it common?
It is one of the commonest cancers that we see in our country. And so some types of oral cavity cancers are in fact known as the Indian cancer. So there is a cancer known as gingivobuccal sulcus cancer that is essentially known the world over as the Indian cancer.
Indian cancer. Oh. So ma'am, as you explained, it is a very common cancer, yet it detected very late. Why?
So most of the people who present with these cancers, up to almost 80% of them, present to us surgical oncologists in the later stages, that is stage 3 and stage 4, primarily because of fear, because of lack of awareness, because some people may not have access to the expertise to determine what this problem is. And the fourth being inaffordability, which is a common problem in our country as well.
मैम, जैसे आपने बताया कि ये कॉमनेस्ट कैंसर है, बट इट इज डिटेक्टेड लेट, तो हमको बाद में पता चलता है कि हाँ, ये हम स्टेज पे हैं कैंसर के, बट देयर मस्ट बी सम साइन और सिम्टम्स जिससे हमको आइडेंटिफाई हो जाए कि हाँ, वी आर हैविंग ओरल कैंसर.
So yes, there are some red flag signs that can help us detect these oral cavity cancers a little early. Some of these signs include any non-healing ulcer anywhere in the oral cavity. मतलब एक मुंह का छाला है जो कई दिनों से 2 या 3 हफ्तों से ट्रीटमेंट देने के बावजूद अगर वो ठीक नहीं होता है, then that is one of the commonest symptoms of oral cavity cancer. मुंह में जलन होना or burning, pain while swallowing, difficulty swallowing, difficulty moving the tongue, difficulty opening the mouth, दांतों में loose teeth can be another symptom of oral cavity cancer. Bleeding from the oral cavity, breathing from any of these ulcers can be another symptom to watch out for. And in addition to that, कान में दर्द होना can be a symptom of tongue cancer. So because there is something called as referred pain, कि जुबान पे छाला होने के बावजूद उसका दर्द कानों तक पहुंचता है। और
Okay.
कई बार वो मिस किया जाता है क्योंकि लोग कान के दर्द पे कंसंट्रेट
हाँ,
करते
हमें
हैं।
लगता है कि वो कान का दर्द है तो वी जनरली गो फॉर ईएनटी डॉक्टर्स।
राइट, सो कैसे होता है कि वो कान के दर्द के पीछे मुंह चेक कभी कभी मिस आउट होता है।
हाँ, डेफिनेटली।
सो दैट इज समथिंग दैट वी हैव टू वॉच आउट फॉर। और जैसे जैसे कैंसर्स बढ़ते हैं तो ये जो ओरल कैविटी कैंसर्स है उनका स्प्रेड जो है वो गले की ग्रंथियों में, जिनको हम लिम्फ नोड्स बोलते हैं, उनमें हो सकता है।
ओके।
और ये जो लिम्फ नोड्स में स्प्रेड होता है गले के, दे में प्रेजेंट एज अ स्वेलिंग इन द नेक।
ओके।
सो कई सारे लोग गले में स्वेलिंग लेके आते हैं, एंड दैट कैन बी अ मैनिफेस्टेशन और अ साइन ऑफ ओरल कैविटी कैंसर। और एकदम लेट स्टेजेस में ऑफ कोर्स वेट लॉस आल्सो इज अ प्रॉब्लम, क्योंकि ये जो मुंह में जो प्रॉब्लम्स रहते हैं उस वजह से उनको निगलने में, खाने में तकलीफ होने के कारण वेट लॉस आल्सो बिकम्स अ प्रॉब्लम। In addition to the cancer itself, cancer cells have the ability to steal nutrition
ओके।
from
द
the
सेल्स।
body, and that is how weight loss also happens. In addition to that, अगर किसी को डेंचर्स है और वो डेंचर्स इल फिटिंग है या लूजनिंग ऑफ टीथ है adjacent to the dentures, so that also may be one of the symptoms of oral cavity cancer.
हम दैट इज वेरी पर्सनल क्वेश्चन आई हैव, दैट इज मैंने कई लोगों को देखा है कि अल्सर होता है, छाले होते हैं, वो रिपीट होते हैं कि कुछ दिन पहले हुए फिर से हो गए, दे टेक मेडिसिन, उसके बाद वो रिपीट होते जाते हैं, तो इज दैट आल्सो अ सिम्टम ऑफ ओरल कैंसर?
It could be.
ओके।
There are some patients in whom कभी कभी विटामिन डेफिशिएंसीज के कारण, अनीमिया के कारण, या some other problems can give rise to these ulcers, repeated ulcers. और कैसे होता है कि repeated injury to any area, that is the primary basis of how cancer cells develop. Repeated injury to any area, repeated trauma to any area. So ये जो बार बार मुंह में छाले होना, there must be some inciting factor जिसकी वजह से ये बार बार छाले हो रहे। सो अ डिटेल्ड हिस्ट्री फॉर दीज पेशेंट्स इज वेरी इंपॉर्टेंट, कि कब होते हैं, क्या लेने से होते हैं, किस वजह से होते हैं, स्ट्रेस में होते हैं, व्हाट इज द नेचर ऑफ दोज अल्सर्स, and it's best to come and show us surgical oncologists, so that it's easier for us to pick up if there is anything that looks suspicious, looks sinister. We can tackle it right there and then, and we can pick up these lesions in a very early stage or even in the precancerous stage. That is the whole aim of this oral cavity cancer awareness month, कि आप अवेयर हो जाओ ताकि छोटे से छोटे प्रॉब्लम में हम अगर सही इलाज कराए तो we can probably pick it up in an early stage or pick it up in a pre-cancerous stage and prevent it completely.
मैम बेसिकली होता है कि ह्यूमन हैव अ टेंडेंसी कि उन्हें कैंसर से डर लगता है, तो आई थिंक देयर मस्ट बी अ सेइंग आल्सो कि कैंसर इज नॉट दैट मच डेंजरस दैट देन द फियर ऑफ कैंसर। यू मस्ट बी अंडरस्टैंडिंग दैट, क्योंकि कैंसर सुनते से ही लोग घबरा जाते कि नहीं नहीं हमें नहीं दिखाना है करके, अगर मेरे को छाला भी होगा तो मैं डेफिनेटली आई एम डोंट गो टू कैंसर के लिए, मुझे कैंसर हो सकता है इस चीज से, बट इट कैन लीड टू कैंसर।
So most of the times, and in our country especially, this is absolutely spot on, because fear and denial is one of the things that I commonly see in our patients. In fact, just last week I biopsied a patient, and when the biopsy report came, of course it was malignancy. The patient's son and daughter came to me saying that, madam, he was very sure, he said की बघा काय एक ह्याच्यामध्ये काही कॅन्सर निघणार नाही. So this denial, this fear, I think acceptance is something that we should be more forthcoming with. And if there is a problem, show it to us specialists so that we can rule out the most sinister problem. What happens is when we try to gain an answer that we want to hear, we may not be doing justice, or we may not be able to diagnose these ulcers and tumors in an early stage just for the want कि नहीं मुझे कुछ नहीं है, उनको सिर्फ चाहिए कि कोई उनको बताए कि नहीं ये कुछ नहीं है, which may
लोगों को
not be
होता
the
है.
fact.
Yeah, exactly. Ma'am, what are the causes and risk factors of oral cancer?
So, risk factors for oral cavity cancer. So, you can categorize it into two subtypes. One is hereditary risk, hereditary causes, and the other is environmental causes. Now, hereditary causes are something that you cannot change, it's the
Okay.
constitution of each person's body. But environmental factors, on the other hand, they are essentially preventable risk factors. So these are the ones that you can control, you can change just by modifying our lifestyle. So the commonest cause of oral cavity cancers in our country is tobacco
Okay.
and tobacco related habits. Other addictive habits like alcohol, high risk drugs like marijuana, cocaine, and other
Okay, they are
drugs.
also affecting your mouth.
Yes. Some of the other causes include viral infections. There is a virus known as HPV virus, for whom now we have discovered the HPV vaccine, which is going to be able to prevent almost 9 strains of this virus and going to reduce the risk of oral cavity cancers in a small percentage. Of course, in our country, the predisposition to HPV related oral cavity cancers is much less. Oropharyngeal cancers are commoner. They have a commoner predisposition to HPV viral infections.
Okay.
And the other important risk factors include sharp dental cusps. That means your sharp jagged teeth. अगर टूटा हुआ दांत है जिसको हम डेंटिस्ट के पास जा नहीं रहे, उसको बराबर से फिटिंग नहीं कराते हैं या उसको घिसाते नहीं है so that it becomes smooth, then these sharp teeth, they injure the tongue, they injure the cheek, and that is how repeated trauma can cause malignancy. Some of the other causes include pre-malignant lesions. Some individuals are just generally, as an inherent nature itself, their body's composition, they are more likely to develop some of the pre-malignant lesions like oral lichen planus, leukoplakia, verrucous hyperplasia, verrucous leukoplakia, erythroleukoplakia. These are some of the pre-malignant lesions that are commonly seen in the oral cavity, and उनका लंबे समय तक ये इंजरीज की वजह से, लंबे समय तक ये अल्सर्स रहने की वजह से they can transform into malignancy.
Okay.
In addition to that, reflux disease, that is laryngopharyngeal reflux disease or gastroesophageal reflux disease, because of the reflux, it can also cause some of the oral cavity cancers.
Okay.
Of course, sun exposure is instrumental in causing lip cancers because of UV exposure, radiation, chemical exposure. Lack of physical activity and obesity has a less preponderance to develop these cancers. It's mainly addictive habits, dental factors, viral infections, low immunity, low vitamin A, vitamin D levels, and of course reflux disease, as I mentioned previously. So these are some of the common risk factors, and if you actually see, most of them can be curtailed or they can be controlled, because these are all lifestyle changes, lifestyle modification ke saath these factors can be controlled. The moment you give up smoking or tobacco related habits, it can reduce our chances to a certain extent. But of course, it takes almost 10 to 20 years of cessation of habits for our risk to be equal to, in case we are taking any addictive substances, it may be our risk goes down to the risk of a normal person not taking these habits, but after 10 to 20 years. So we have to consciously make these efforts, and it is extremely important that we go ahead and do this.
Okay. मैम आई हैव सीन कि यंगर पीपल में नाउ, मतलब जो यंगर एज हमारी है, यंगर पीपल है, यंगर जनरेशन है, उनमें ज्यादा हो रहा है ये ओरल कैंसर.
सो सच्ची बताऊँ तो these cancers used to be seen mainly in the elderly age group, say
या
50 and
ओके.
above. But अभी क्योंकि the younger generation, Gen Z, Gen Alpha,
अल्फा.
Beta, so all of these are more social media exposed uh, because of peer pressure. In colleges itself, a lot of these younger students sometimes get exposed to these addictive habits and high risk
डेफिनेटली.
habits. So on account of that, imagine their exposure is much more early on, and hence nowadays we are seeing a lot of our patients in the second and the third decade of life,
ओके.
with these malignancies in their 20s and 30s. So yes, there is a shift from what was seen in patients who were above 50 and 60 years. So we are seeing these cancers early on. Also, what happens with these addictive habits? So these tobacco has almost 74 carcinogens,
ओके.
and that a lot of people don't realize. In fact, the government has a statutory warning on
ऑन द.
the cigarette packets and the tobacco packets, saying that, with gory pictures, but still somehow it doesn't deter people from, making do with this habit, unfortunately. And that is something that we have to change in order to reduce
ओरल.
our risk of developing this disease.
Once a patient or once a person gets to know कि he or she is having oral cancer, and how to diagnose and when to act.
So, first and foremost, the one thing that should raise our antennae is that something in our body that is wrong, that is abnormal, and that has not healed in 2 to 3 weeks. I already mentioned about the symptoms previously. So, the moment you have anything anywhere in the body, let alone oral cavity cancer, I think first come forward and get it evaluated.
Okay.
Oral cavity cancer, that way it's very easy to evaluate. You just look into the mirror, open your mouth. If you find anything abnormal, it is quite easy to pick up. It does not require any major
Machinery.
X-ray, mammography, CT scan, none of these imaging modalities. This is one of the easiest cancer to screen, and yet in India we are not able to screen these cancers and pick up these patients in the precancerous or the early cancerous stage. Having said that, the first step is to get examined by a specialist, get the required imaging done in case there is something special, something suspicious, and the specialist confirms the same.
Okay.
And the third thing that is needed to be done is, if there is something that is suspicious that we can see, even the imaging is kind of confirming that, we have to go ahead and prove it with the help of a biopsy. So these are the three pillars of being able to diagnose any cancer. One is a good clinical examination and a history. Second is an imaging. So the imaging can be anything: CT scan, MRI, PET scan, of course, whatever the surgical oncologist suggests based on the site and the location, and what the surgical oncologist feels is the clinical stage or the presentation of that particular lesion. And the third thing, of course, is a biopsy, which is a tissue diagnosis to prove whatever we are suspecting. After this, we have to go ahead and stage the disease. So, this is the most instrumental and important thing in us being able to arrive at a diagnosis and stage the disease.
Okay. Ma'am, as you mentioned biopsy, so is it very important to have a biopsy before diagnosis?
Biopsy is instrumental and the most important thing that will lead us to the diagnosis.
Okay.
So, even in oral cavity cancers, there are various subtypes, and a biopsy is very important to be able to understand the grade, the other subtypes that may be there. So there are carcinomas, there are sarcomas, there are carcinosarcomas. These are all subtypes of oral cavity cancers. So
Okay.
in order that we can decide how to move forward with treatment, we need a biopsy, and it is essential.
ओके मैम, आई हैव हर्ड कि कई लोगों को ऐसा लगता है कि बायोप्सी से जो कैंसर है वो स्प्रेड हो जाएगा, तो इज इट ट्रू?
This is an absolute myth.
ओके.
It is, see, a biopsy essentially, you don't remove the entire tumor, you just take a part of that tumor along with normal tissue
Okay.
and send it for testing to be able to understand what the type is, whether it is malignancy, and if it is malignancy, what the subtype is, as I mentioned previously.
Huh.
And no, cancer does not spread with a biopsy, because the biopsy is obviously the next in sequence is initiation of treatment. Yes, if you biopsy and don't treat the patient for years to come, there are many patients like that. They've biopsied maybe 1 or 2 years prior, but because of fear, because of denial, they have not gone ahead with treatment. Then, of course, the tumor is going to grow
Spread.
irrespective of what is done. So,
Okay.
no, the answer is absolutely not. Biopsy does not lead to spread of cancer.
Okay. Ma'am, as you said, this is our biggest myth. So there must be some more myths you must knowing.
Yes, let's bust some of these myths.
Okay.
Okay, so there are quite a few people I come across who mention that only tobacco, or who feel only tobacco is the predisposing factor for oral cavity cancers.
Okay.
Which, as I mentioned to you previously, I mentioned to you the risk factors, and that is not entirely true.
Huh.
True, because oral cavity cancers are also seen in women, and not all of them would have tobacco-related habits. Not all, I think most of the women don't, unless there is a history of application of misri, which is like a kind of toothpaste that they use in the villages, which
Okay.
is tobacco laden.
Okay.
So, apart from tobacco, as I mentioned previously, you have sharp teeth, eating spicy food, eating hot food, exposure to chemicals in the oral cavity, viral exposure, reflux disease, alcohol exposure. So these are some of the other risk factors. So tobacco is not the only one.
Okay.
In addition to that, of course, pre-malignant lesions are always a major risk factor in order to develop oral cavity cancer. So no, tobacco is definitely not the only risk factor.
Okay.
Another important myth is this is a disease of the elderly and not so much seen in the younger generation, which also I have busted that myth before.
Yeah.
That these days we are seeing a lot of patients in their 20s and 30s and 40s who are, because of their addictive habits early on, they are predisposed to this oral cavity cancer.
Okay.
Some of the other myths, of course, are based on the treatment. Some patients are fearful of surgery, some patients are fearful of radiation, some patients are fearful of chemotherapy. Surgery wise, see, in the yesteryears, there were a lot of disfigurements for these oral cavity cancer patients because it's a very prominent area. That is something that is going to be very obvious. But now with evolved techniques, evolved reconstruction plans, we are able to give a better cosmesis. So it is no longer true that disfigurement is part of oral cavity cancer treatment. So another important myth is that a lot of patients say that since I have no pain, it is not likely to be cancer. But please understand that oral cavity cancers don't always present with pain. Pain
Okay.
is a late feature of oral cavity cancers. Initial presentation may be a painless ulcer in the oral cavity.
Okay.
So these are some of the myths and facts, and of course there are quite a few more, but you can't always cover all of them. Perhaps we can take another session just on myths and facts.
Definitely, we'll have another session for that. Ma'am, if one diagnosed with an oral cancer, what is the treatment and how, after the treatment, the recovery will take place?
So, as I mentioned to you previously,
Mm.
first, after diagnosis, you have to go ahead and stage the patient.
Okay.
Based on the stage of the patient, the treatment is initiated.
Hmm.
As far as oral cavity cancers are concerned, surgery is the treatment of choice for these types of cancers. Chemotherapy and radiation uh, may be added either in the neoadjuvant setting,
Hmm.
uh, especially chemotherapy in the neoadjuvant setting.
Hmm.
Radiation generally is added in the adjuvant setting with or without chemotherapy
Okay.
based on the stage of these tumors. So, early stage tumors generally surgery may be enough, especially stage 1 tumors.
Hmm.
Surgery may be enough if all the margins of resection are clear and there are no other high risk features suggesting the institution of adjuvant therapy. What I mean by adjuvant therapy is therapy in the post operative setting. You have to supplement surgery
Hmm.
with some additional form of therapy if there are certain high risk features.
Okay.
Radiation and chemotherapy, on the other hand, radiation, as you know, is basically giving radiation to that particular area. That is another form of local treatment. So,
Okay.
surgery and radiation are local treatments,
Hmm.
while chemotherapy is systemic treatment, means it acts on tumor cells in the circulating blood as well
Okay.
and in the rest of the body.
ठीक है.
Uh, Chemotherapy may be instituted in the neoadjuvant setting, means if there is a large tumor, say a stage 4 tumor, which is borderline operable or inoperable,
Hmm.
then initially chemotherapy is given. The patient is reassessed after a couple of cycles.
Hmm.
If there is a good response,
Hmm.
then surgery is advocated. If not, then you have to go ahead with definitive chemo radiation with a palliative intent.
Okay.
While uh, after surgery also, these patients, if at all, of course, if they are amenable to surgery, these patients also require adjuvant chemoradiation if they have received chemotherapy in the neoadjuvant setting. So the role of chemotherapy is mainly when the stage is in the later stages. In the earlier stages, surgery is definitely the treatment of choice. Now, of course, there is a newer kid on the block, that is immunotherapy,
Ah.
which essentially works with uh, building the patient's, strengthening the patient's immune system to be able to fight this tumor. Of course, there are a lot of guidelines and criteria. We go ahead and keep into mind the global guidelines in order to institute treatment for these patients. And all our patients are discussed in a multidisciplinary tumor board.
Hmm.
And while keeping the global guidelines in mind and following the global guidelines, we also have to individualize treatment as per patient's performance status, patient's requirements, patient's disease, because each patient's cancer is different. Each
Definitely.
patient's ability to withstand treatment is different, and each patient's motivation is different. So, another important part, especially with oral cavity cancers, is while surgery is the treatment of choice, this surgery has two components.
Hmm.
One is resection of the tumor, what we call as oncological resection.
Hmm.
So, we remove tumor with normal margins all around. There
Okay.
is a criteria for a minimum margin of normal tissue required around this tumor specimen,
Hmm.
all 360 degrees.
Hmm.
And in addition to that, after we assess for adequacy of margins, we have to do a neck dissection for these patients, that is, remove lymph nodes in the neck, because most of these oral cavity cancers
Hmm.
have a predisposition of these tumors to spread to the neck nodes, and
Okay.
hence, for a staging purpose, for a pathological staging purpose, we have to do what is known as a staging neck dissection. And once this is done, if the defect is large enough that we cannot close it primarily, we have to go ahead with some form of reconstruction, because you can't just remove the jawbone and leave the patient without a jaw. You have to
Definitely.
reconstruct the jaw. We have to reconstruct the buccal mucosa. You have to reconstruct the tongue if at all we're dealing with tongue tumors. So reconstruction is an important part of rehabilitation and ensuring good functional and cosmetic outcomes as much as possible, while maintaining oncological safety and oncological clearance.
Okay.
So this is how treatment is initiated, and this is how we go ahead with it. Post treatment rehabilitation is extremely important, because this is a very important area where functions like speech, swallowing are, you know, directly connected to this. So we have to ensure that these patients start with rehabilitation as regards their speech, swallowing, as well as ambulation, because that also sometimes we take flaps from the thigh or the leg, or the bone from the leg, or from the hand. So then if you're taking bone from the leg, again, to get them to walk normally, they walk normally with treatment, about 5 to 7 days of physiotherapy, and they're walking like as if nothing has happened. But this is an important part and parcel of management of these patients. So it is a holistic approach. It is not just surgery kiya ho gaya. It is surgery, chemotherapy, radiation, plus minus immunotherapy, rehabilitation, all is one big multidisciplinary management that goes into treating these oral cavity cancer patients.
Okay, ma'am, that you said कि it is a very important surgery के बाद बहुत सारी stages होती है जिनमें हमको patient को treat करना पड़ता है. Is there any role of robotic in this surgery?
So yes, robotic surgery has come in a big way in surgery in general, as well as surgical oncology, that is cancer related surgery, and also to a certain extent in management of oral cavity cancers.
Okay.
These days, in suitable patients, we are doing neck dissections. As I mentioned, you need to do a staging neck dissection. Although our neck dissection scars, even when we do it with open technique, they are very good. We take relatively smaller incisions, not gory scars that used to be seen in the yesteryears. Still, we may be taking about a 5 to 7 to 8 centimeter incision over the neck. We are now robotically avoiding any visible scars on the neck and using something called as robotic infraclavicular approach for minimally invasive neck dissection.
Okay.
That is our approach, and we use small 8 millimeter scars below the level of the clavicle.
Okay, 5 centimeters से 8 millimeter.
8 millimeters, but of course you have to take about 3 or 4 scars below the level of the clavicle, but is not seen over the neck. So, but the criteria in order to do these robotic neck dissections is that we have to have very small oral cavity tumors that don't require a major flap reconstruction.
Okay.
So, small tongue cancers or very small buccal mucosal cancers that don't require any major reconstruction can, these may be the patients who can go ahead and be treated by robotic neck dissections. Having said that, we also have to ensure that there is no big involved node, that is a diseased node in the neck, in order to go ahead with a robotic infraclavicular approach. We here at Apollo hospitals are doing this approach. Of course, it is pioneered by Dr. Sandeep Nayak, and we are, trained in this approach.
Okay. Ma'am, as we discussed the treatment and recovery, so I have one question कि अगर after treatment or recovery, is there a possibility कि cancer can be reoccurred?
So yes, there is always a chance of recurrence, but that is why we stress on early detection.
Okay.
जितना जल्दी हम कैंसर को डिटेक्ट करते हैं, जितना जल्दी हम ट्रीट करते हैं और अच्छे से ट्रीट करते हैं, उतना कम रेकरेंस के चांसेस होते हैं.
Okay.
सो अगर सपोज आई एम जस्ट गिविंग यू आर्बिट्री नंबर्स, बट एन अप्रोक्सीमेट दिस थिंग की स्टेज 1 कैंसर है, तो वी जनरली टॉक इन टर्म्स ऑफ 5 year सर्वाइवल.
Okay.
ओके, सो स्टेज 1 कैंसर का 5 year सर्वाइवल है अपवर्ड्स ऑफ 95%. मतलब 100 लोगों में से 95 लोग आराम से 95 लोग आराम से 5 years तक सर्वाइव कर जाएंगे
In stage 1.
in stage 1.
Okay.
That only the chances of 5 year survival, the percentage of 5 year survival goes down to almost maybe 30% in stage 4 cancer. So
Okay.
that is the difference. And
Okay.
hence we always stress about early detection saves lives. So वैसे ही जैसे स्टेज 1 में अगर हम पेशेंट को डिटेक्ट करते हैं तो उनके रेकरेंस के चांसेस कम रहते हैं. Recurrence is generally detected within the first 2 years of undergoing treatment.
Okay.
Okay. So that recurrence percentage is significantly low in stage 1 vis-a-vis it is very high in stage 4, and it is a upward. Stage 1 may suppose the chances of recurrence are 5 to 10%. Same thing in stage 2, the chances of recurrence are maybe 20 to 25%. That in stage 3 is about 50%. And that at stage 4 would be almost 70 or 75, 80%.
Okay.
So this is what you need to keep in mind, and hence we always stress on the fact that come early so that it can be picked up early and it can be treated early. Now the chances of us detecting a recurrence if the patient does not come for follow-up for 2-3 years is going to be zero.
Definitely.
Right? So follow-up is an important part of management of oral cavity cancers, of any cancers for that matter. And generally for the first year they come a little more frequently as part of the follow-up. Second year the gap of the follow-up increases. Third year onwards it increases further, and after 5 years maybe they even just see us once in a year if at all. Imaging may be required as part of the follow-up plan.
Ma'am, now I have a very simple question, but जो मेरे mind में है कि you are the doctor and जब लोगों को पता चलता है कि they are having cancer, और क्योंकि वो वैसे ही बहुत डरे हुए stress होते हैं, तो how you handle them?
So being in the surgical oncology field teaches you not only the treatment and the management part, it also teaches you to be very good psycho-oncological counselors.
Okay.
Because that is a part and parcel. It is a
Definitely.
devastating diagnosis to reveal, and it is a shock for patients. Shock, fear, emotions, all that are part and parcel when this diagnosis is revealed, and you have to be empathetic towards them, which is part of what we do. And hence you will never see us having hundreds of patients like general practitioners, because we cannot do 1 or 2 minute consultations, we cannot do 5-minute consultations. For us, a minimum consult can be anywhere between 15 to 30 minutes or even more.
Okay.
Because you need that much of time to reveal the diagnosis, to explain to them what to expect, what not to expect, to counsel them as to how treatment has to be initiated and what their journey is going to be beyond that, including the quality of life. So, yes, it is extremely important as us professionals to be able to counsel our patients, because this is not a small disease, and hence sometimes in addition to our counseling we may also have to counsel not only the patient but their family as well, because this
Everybody
disease,
is involved in this
yes,
particularly.
this disease, unfortunately, is not only the patient's battle, but it is also the battle of all their family members and the support system.
Definitely.
So, in addition to our counseling, some patients may also require additional counseling from dedicated psycho-oncologists, who
Okay.
there are quite a few now. Even at Apollo Pune, we have psycho-oncologists for some patients who are not as motivated or who need a little more clarity in their treatment plan to go ahead and execute and withstand the treatment.
ओके, थैंक यू मैम. मतलब आई एम वेरी अवेयर कि अब ओरल कैंसर क्या होता है. आई थिंक आई एम वेरी मच श्योर कि मेरे ऑडियंस को भी पता चल गया होगा कि ओरल कैंसर क्या होता है. तो मैम बस एक लास्ट मैसेज हमारे ऑडियंस के लिए.
So, oral cavity cancers is a topic that not a lot of people have discussed. Everybody knows about breast cancer. Everybody knows about cervical cancer.
Definitely.
You know, the commoner women-related cancers, because that has been talked about in the
More.
media so much.
Yeah.
Oral cavity cancers, people ask me, what do you do as a head and neck surgical oncologist? And, you know, for me to explain to them what are the vast number of cancers that fall in this gamut, including thyroid cancers, oral cavity cancers, etc., etc. So, oral cavity cancers में भी इतने सारे types है. So, one simple message to the audience would be that early detection cures lives. So, if we are able to detect these cancers early, we can ensure a better cure, better survival, and a better quality of life. Having said that, please understand that oral cavity cancers are preventable by just modifying a few lives and incorporating a few lifestyle changes. So, prevention is better than cure as far as oral cavity cancers are concerned, and early detection cures lives.
Thank you, ma'am. It was a very insightful session that we have. I think we should have a more session like this. So we'll meet you soon. Thank you, ma'am.
Thank you so much, Gunjan, for this lovely podcast, an
Thank you.
informative one. I hope it benefits the audience.
Definitely, definitely.